Discover the latest health tips, expert advice, and inspiring stories. This is the Health Channel Podcast. Your journey to better health starts now.
By themselves, prescription and over-the-counter medications are pretty safe, as are most supplements, but combining the wrong ones can be a recipe for disaster and trigger dangerous, even life-threatening reactions. Today, we have Dr. Madeline Camejo, Chief Pharmacy Officer at Baptist Health, and also joining us is Dr. Yamilia Suros, Manager of Ambulatory Pharmacy at Baptist Health. They're here to share their expert advice and answer all your questions on this episode of Ask the Doc, No Appointment Needed. Hi, everyone. I'm Olga Villaverde, and welcome to Ask the Doc, the show where we encourage our viewers to send in their health questions. So we're going to kick off this amazing show with a question from Antoinette, who reached out through our website, allhealthtv.com. And here's her question. Hi, Dr. Camejo. I'm taking prescription meds for a heart condition, which can make me a little drowsy. A friend suggested that I take an herbal supplement to help give me a little more pep in my step. Should I be at all concerned about any possible negative interactions? That is a great question to start the show with, Dr. Camejo. What are your thoughts?
Hi, Olga. You're absolutely right. And thanks, Antoinette, for reaching out to us with it. But yes, some over-the-counter products or supplements interfere with how prescription medications work. They either make them too weak or too strong, and even certain combinations can create harmful chemical reactions in the body that may damage organs or even worsen conditions. But a lot of times of mixing products can change how medications is metabolized, so increasing the risk of unexpected or even more side effects. So the most important thing is that before you buy any supplement, please talk to your pharmacist. They will help you guide what you would need to be more appropriate with your medications.
Great answer. Thank you so much, Dr. Camejo. All right, our next question is from YouTube, and it is from Jasper. And this is what the question is. Hey, Dr. C, my mother is in her late 70s and takes prescription meds for some respiratory issues. This would be fine, but I've noticed some over-the-counter meds on her nightstand, which has me a little concerned. What are some signs that a medication or supplement interaction might be occurring, and when should you seek medical advice? Okay, I love the question, and I love the fact that he's so worried about his mother as well, Dr. Camejo.
I am too. And Jasper, kudos to you for keeping an eye out on your mother. She's one lucky lady. But I'm going to let Dr. Suros answer this one. She sees a lot of these patients in clinic.
Hi. If your mother is taking prescription medications along with over-the-counter products, it is important to watch for possible interactions such as dizziness, stomach upset, confusion, changes in heart rate, and fatigue. Also, any new symptoms that wasn't present before. When it comes to seeking medical advice, it is best to do so right away. Sometimes it can be as simple as calling or visiting your local pharmacy and speaking with the pharmacist there. They can quickly assess whether the symptoms may be related to a medication interaction and definitely guide you on the next steps.
Excellent. Thank you so much, Dr. Suros. All right, we've got a Facebook question, so appreciate those as well. And this one is from DJ. So DJ is in the house. Here we go. Dr. Camejo, my mom's also in her late 70s, or 70s, I should say. And I got to tell you, she's a real pistol. Linda, who takes meds for some circulatory issues, likes to have a quick nightcap before she goes to bed. Can this cause an adverse effect when taken with prescription drugs? Well, I have to confess too, my late grandmother used to have a cocktail every night as well, Dr. Camejo. So what are your thoughts here?
Well, sometimes it could be a good thing. Sometimes it can be a bad thing. But, alcohol, caffeine, even certain foods can change how medications are absorbed or even broken down. So a lot of times alcohol can increase sedation actually, and not make your medications work effectively. Caffeine may also reduce medication effectiveness and even worsen anxieties. So depending, like a lot of people might like to have some Coke at the end of the night. Even grapefruit can interfere with drug metabolism. But, since your mom takes medication for circulatory issues, a nightly drink could also affect her heart rate, blood pressure, and overall affect the medication's effects. So be very careful with that.
All right. Speaking of allhealthtv.com, we have another question from there. And this time it's from Jan. And this is what they write. Hi, Dr. Camejo. My doctor just told me I needed to be on blood pressure medication. I take a lot of vitamins and health supplements. Are there any that I should avoid because they can interact with the BP meds? I love this question because I actually take blood pressure medication as well, doctor. I love my vitamins. So I'm even going to tune in here what you have to say.
Oh, yeah. Dr. Suros, what are your thoughts on this one?
This is definitely an important question. Yes, some vitamins and herbal supplements can definitely interact with blood pressure medications. For example, garlic supplements can sometimes lower blood pressure more than intended when taken along with blood pressure meds. Kava, which is used often, can cause blood pressure to drop too low. And St. John wort can reduce the effectiveness of certain blood pressure medication, which means they might not work as well. It is also very important to be cautious with products marketed for energy or weight loss. Those products often contain hidden stimulants that can increase your heart rate or blood pressure, even if the label doesn't make it obvious.
Dr. Suros, let me just ask you something, if you don't mind. What about if someone like me right now, I have a little cold and I had a little bit of acute bronchitis a couple of weeks ago. So I've been taking a lot of elderberry and things like that, like the vitamin C gummies. Is that okay if you're on blood pressure medication as well? Because I'm trying to boost my immune system, if you will.
I will definitely advise you to go ahead and check that with the pharmacist at the pharmacy. When you pick up your blood pressure meds, let them know what over-the-counters or supplements you're taking, and they can quickly do a drug interaction there for you and give you their best advice.
So basically, don't attempt to do it on your own. Always seek
Definitely
medical
not.
advice. And certainly don't do the Dr. Google.
Not at all.
All right. And I'm glad you told me that because I started doing it a couple of days ago. So I'm going to go see my pharmacist today and make sure that's okay for me to do. Appreciate that, Dr. Suros. We've got another YouTube question, and this one is from Cordell. Thank you, Cordell. Dr. Camejo, I'd like to know if there are certain supplement and medicine combinations you see patients frequently overlook that can be dangerous or reduce medication effectiveness. Okay, so that's a good question too, Doctor. Your thoughts?
Olga, that one is a really good question. And Cordell, this happens all the time, but it absolutely shouldn't. Yes, there are definitely some supplement and medication combinations that people tend to overlook. For example, people who are taking warfarin with NSAIDs or certain supplements like what Dr. Suros explained, like garlic, can raise the risk of internal or gastrointestinal bleeding. So another one could be a calcium supplements with thiazide diuretics. And since thiazides reduce calcium excretion, the combination can lead to high calcium levels in your blood. So a lot of people also don't realize that even grapefruit juice can interact with certain medications like statin, like a simvastatin, can also increase the drug level in the body and can raise side effects that make you not feel well at all. And if somebody really loves grapefruit, then they're better off doing more of a water-soluble statin, or like a pravastatin. Those are better. But having those conversations with the pharmacist can help you change medications that can still deal with your symptoms in your body. I think that's really important. Another one is a thyroid medication. Like if you take them too close to an antacid or a calcium supplement, can decrease the absorption of the thyroid medication. That it won't work as well. So there are these kinds of combinations are really a good time to really speak to a pharmacist. So they really watch for this all the time, but it can easily be missed, but can have a huge impact on you.
And Dr. Camejo, when you say huge impact, what can happen? What are the effects of something like that?
So, for example, if you get, high levels of calcium, in your body, you can have heart issues, feel differently. And sometimes it can even land you in the emergency room because you're not sure the side effects could be really strongly to where you're not feeling really well, that you may end up have to go to the emergency room. So be very careful. There are certain medications. That's why I said when Yami says, because you have to take the supplement and look at the back of the ingredients to see what's in those supplements because they're not all the same. And so having a pharmacist before you go, take the supplement to the pharmacist and say, hey, I'm thinking about doing this to boost my immune system or something. Let that pharmacist look at the actual ingredients in the bottle and check your profile. And you can take supplements if you do it in a safe way. Maybe take the supplement in the morning, take the thyroid medication at night, because that time you've already metabolized certain things. And so those are things that are important for you to go see your pharmacist.
Excellent information. Thank you so much, Doctor. All right, a Facebook question for you, Dr. Camejo. Let's take a look. And this is from Quentin. Hello, Doctors Camejo and Suros. As a future pharmacist, I'd like to know what role pharmacists play in helping patients manage multiple medications safely. Nice question there, Quentin. Thank you so much. Dr. C, I'm going to start with you.
So, Olga, I think Dr. Suros and I are pretty much uniquely qualified in that department and knowledge. But, I answered kind of that question in my previous, but I'm going to let Dr. Suros answer this one.
Hi. So pharmacists definitely play a huge role in keeping medications and patients safe, especially when someone is taking multiple medications. They look at the full picture to make sure prescriptions, over-the-counter products, and supplements all work together without causing any problems. A pharmacist can definitely review your medication for possible interactions or duplications, and they can offer dosing guidance and safety tips so you are make sure you're taking everything correctly. They also make sure your prescriptions and over-the-counter products are compatible, since even everyday items can interfere with your prescription medications. And when it comes to stay organized, pharmacies are great resources. They can suggest things like weekly pill organizers, setting phone reminders, or keeping a simple updated medication list to help you manage everything a lot easier.
Excellent. Thank you so much. Before we get to our next question with Avery, Dr. Camejo, I got one on my cell phone from a friend of mine who's actually watching, and she's asking, what about ginkgo biloba? I hope I said that correctly, doctor. A lot of older
ginkgo biloba. That's another one that can cause a lot of interactions with medication. So depending on what you're taking, that definitely has some risk to it as well.
Right, because she writes here, a lot of older people like my mom take it to improve their memory.
Memory, yeah, that's the thing that you want to use it for memory. But depending on what your mom's med, so I don't know the actual profile what her mom's medications may be on, but definitely take her mom's list or go to the pharmacy where she gets her medications and say, listen, my mom's on this. Is there any one medication that interacts, and can I, take them at a different time so she can still take the ginkgo biloba?
All right. Excellent. Such an easy thing to do. Just go to the pharmacist, make sure, check off the boxes and move on. I love it. All right, Dr. Camejo, we're going to go to the tube again. So this is from Avery, and Avery writes the following. Hi, doctors. Many people, myself included, assume that the word natural, gosh, I love this question, natural on herbal products automatically means it's safe. But I guess that's not necessarily true, especially as it pertains to potential interactions with prescription drugs, right? Oh my gosh, Avery, love this question. Every time someone sees natural, they think, I'm good to go. Not the case.
Agreed. And Avery, I'm so glad you're asking this question because it is become a serious problem with some serious implication. And you're absolutely right. Just because something's natural doesn't mean it's automatically safe. Natural products are regulated and are strictly as prescription medications. This means their strength can vary and there's a chance of contamination or questionable ingredients. They can still be harmful and simply not be what they claim. But Dr. Suros, I know that you all may have some thoughts on this. Do you want to also weigh in on this question?
Sure, I agree with you. And what a great question also. But many plant-based supplements can also interfere with prescription medications. Some of them can increase side effects. Others can make medications less effective, and some can even trigger dangerous drug reactions. So yes, even natural supplements can cause serious interactions, especially for people who are in chronic medications. That is why it's always, always, always a great idea to check with the pharmacist before you leave the store.
Great stuff. Thank you so much, Dr. Camejo and Dr. Suros. And speaking of allhealthtv.com, we got a great question in from Calvin. And by the way, if you haven't checked out allhealthtv.com, great information there. Check it out. It's a great place to go. Speaking of place to go, let's see what Calvin has to say for us. And he writes, I understand that we have to be careful mixing over-the-counter meds with prescription meds and mixing any kind of meds with alcohol. Are there any foods or caffeinated beverages that we need to be careful about as well? So I guess I'll throw in my little cafecito cubano as well, Dr. Camejo.
Yes, and I agree. That is a great question you're asking. Dr. Suros, why don't you take this one? Because I know I've already answered some of these questions and before in our previous, but I think hearing it from you is also a good thing to do.
Thank you. Thank you. Yes, certain food and even caffeinated drinks can definitely affect how your medications and supplement work together. Let's take grapefruit, for example. It can change the way some medications are metabolized, causing the drug levels in your body to rise and potentially leading to a stronger side effect. This is especially important if you are on blood pressure medications and statins or any other long-term treatments. Now, regarding caffeinated beverages, they can play a role too. For example, caffeine can make medications less effective or worsen symptoms like anxiety or heart palpitations, especially for those patients that are taking stimulants or medication that act on their nervous system.
Thank you so much, Dr. Suros. All right, we're going to go to Instagram. Here's a question from Aubrey, and this is what she writes us. Let's take a look. Dr. Camejo, hi. Maybe you mentioned this before, but what are some of the most common risks people face when combining prescription medications with over-the-counter drugs or supplements? We talked about it just a little bit, but I think it's a great question to dive into again because people don't know what those common risks are, Dr. Camejo.
Yeah. And, Aubrey, I think we may have already, but what it definitely bears repeating. So thanks for reaching out for your question. And again, when you mix prescription medication with over-the-counter products or even supplements, there are a few common risks to come in mind. And sometimes the combination can make your prescription either too weak or too strong. But otherwise, in many cases, certain medications can create harmful byproducts in the body, and they may strain your organs or existing health condition can become worse. So you might also notice stronger or unexpected side effects because combining products that can change the way a medication is metabolized. All of this it's really important why we keep really hammering in to go see your pharmacist before you add any routine. So I'm going to kind of summarize common risk associated with combining prescriptions medication with over-the-counter. One, it can cancel your medication. Your supplement can cancel out your medication. Two, it can really increase side effects. Three, it can cause stress and strain on your organs. Four, can cause bleeding risk. Five, can increase palpitation and cardiac risk. And six, it really can mask symptoms that you may be experiencing that we don't know what they are.
Excellent. Thank you so much, Dr. Camejo. All right, we are going to now get a question for Dr. Suros, and this is on Facebook, and it's from Nadine. Let's see what she writes here, Dr. Suros. Can travel or changes in routine affect medication safety, especially when combining different treatments? Interesting question there, Dr. Suros. What are your thoughts?
Yes, that's a great question because, people are traveling all the time, but definitely when traveling, it's very easy for medication schedules to get thrown off, especially with time zone changes that can make those extremely confusing. Diet changes, dehydration, taking medications at unusual times can also affect how well the treatment is going to work for this patient. So it's great to plan ahead, to keep medications in the original containers and to try to stick to as consistent a schedule as possible when you're traveling and away from home.
And, Olga, I really want to weigh in on this question too, because I think that's really important because I travel all over the world. And one of the things is when you travel, you should always stay in your complete, your original containers. A lot of people tend to put them in all these kinds of stuff. Sometimes when you're coming into another country, they could take your meds away from you, not knowing what they are. So please always travel with your medications in an original container that shows that they do come from a physician, because I have seen where people are coming in and, they check luggage and then they find they will tell you to please dispose of these medications. So be very careful with that.
And doctor, I'm so glad you mentioned that, because when I went to Italy with my family, I almost grabbed my blood pressure medications and just, I didn't want the bulkiness, right? So I was going to put them in a Ziploc bag, and something told me, no, let me just, you know what? They went through it. They made sure it matched my name, and they were very, very strict about it. So great advice there. Okay, I've got one question here that just came in before we go to another one. This is from Angela. So Dr. Camejo, this is what she just wrote to me right now. What about OTC meds and vitamins? How do you know what's good or not good? There wouldn't be a pharmacist involved since they're all over the counter. Your thought?
Look at particular brands. There are really good brands out there that have a good reputation. Trying to think of one. Natural Products has one. Be very careful where you buy your vitamins. And if you're not sure, ask the pharmacist which brand out there really is more reputable, because there are so many vitamin that have a lot of just fillers. They're not really good products. A lot of times I would always say, just don't buy stuff online, because a lot of times you don't have anyone to ask. But there are a couple of good vitamin companies out there that are good and have a good reason to keep them and use them. But ask the pharmacist, because depending on what's out there, there's so many. You can, Nature's Own is one I was thinking. Nature Own is a good one. But just make sure you talk to the pharmacist before you just purchase anything before you go out there.
And that's the one I love. And when it's buy one, get one free, it's even better, Dr. Camejo. All right, let's go to a question now from allhealthtv.com, our website. And this one is from Ricardo. Ricardo, thank you so much. Hola, Dr. Camejo. What are the best ways for patients to keep track of everything they're taking, especially if they see multiple providers? That is an excellent question, because sometimes it could just be a handful and you really don't know where to go anymore, Dr. Camejo.
So I always tell, I do it for my dad and I do it for all of my relatives, because they'll ask me that question, on your iPhone or, there's always a notepad one. It helps if you keep one list of all your medications, including the dose and how often you take them. So everything stays organized and easy to reference. And especially if you go to the physician, because you can't remember, when they're asking you, what's your medication history? You're trying to remember if you're taking a lot of meds, you may not remember the dose, you might not remember anything. But when I take my dad to the doctor, one of the things that I love doing is I put it right on my phone, and then I can either print it, take it to the doctor, say, hey, here, this is what I'm taking. But there's even medication apps too that makes things simpler by letting you log your megs in and set reminders so you don't miss any doses. That's also a good thing to look at. And whenever possible, try to use one pharmacy for all your prescriptions. That way, your pharmacist can really keep an eye on any potential interactions or duplications and really help you stay safe. Do not try to go to this pharmacy one day, another pharmacy another day, or I'm close to this pharmacy, I'll just pick up here, because then you don't have the one person who can really keep it all organized for you.
Absolutely. Dr. Suros, would you like to chime in here?
No, I think she touched on all points, and especially that polypharmacy issue that is very common nowadays. I think it's important for patients to understand that for pharmacists to be able to help them, it is important that they go to one pharmacy only instead of multi-pharmacies, so we can help them to keep all the meds organized and advise them if there's any drug interactions or any issue with any over-the-counters that they might be taking.
And that's really the important thing, is just to be organized and just to make sure you have it all there, because God forbid there is a mix-up. What can happen, Dr. Suros? We're talking hospital, possibly ER.
Correct.
All right. We've got about 55 seconds left. So I'm going to ask both of you to just maybe recap what we've been talking about. Dr. Suros, I'm going to start with you since I have you.
Well, definitely say, be careful when you're picking that bottle over the counter, that natural supplement. As they might seem harmful to you, but they can have interaction with your prescription medication. So be careful, run to that pharmacist and that pharmacy near you and ask them, is there any issue with taking this product with my medications? I think that's the first piece of advice I will give my patients here as we talk about this.
And Dr. Camejo, in maybe just a few seconds.
Same thing. The most important thing, even if you're picking different supplements, make sure you run them by the pharmacist because there could be duplicate ingredients in those supplements.
Fantastic. Thank you, ladies, and thank you for joining us right here on Ask the Doc. I'm Olga Villaverdi. We'll see you next time.
Thank you for listening to the Health Channel podcast. We hope this information has been useful. However, please remember that only your doctor can advise you about what is best for you. Do not start, modify, or suspend treatment based on anything you have heard on this podcast. Please join us again soon.